My name is Ehrman, DVM, and I am at Saugus Animal Hospital, and I answered some questions about boxers. So let's see, question number one, what are the biggest health problems you see with boxers? You know, we always worry about boxers. Cancer is one big thing. They are prone to cancer as a breed. You'll see skin cancers frequently, certain types of internal cancers they're prone to, lymphoma, things like that. So we always watch them very closely for that. And boxers also can have a condition called boxer cardiomyopathy, where they essentially they start to have some heart failure at a younger age. So we do usually watch for that. You know, watch for coughing, watch for any sort of weakness or fainting, anything like that is always a concern with boxers. And as far as things that you do to keep your boxer healthy, certainly having them checked out occasionally, make sure that the vet checks them frequently. Any weird skin lumps, we tend to at least take a sample from those to make sure they're not cancer, because a lot of the skin cancers they can get, the sooner you get them and you remove them, the more likely you are to cure the problem. So that, weight, you want to make sure they're not getting too chubby, make sure they're getting exercise, and normal things like vaccines are always the important thing to watch for. How often you should take a boxer to the vet? Well, with most of them, when they're younger, I would say similar to most other breeds, once a year is generally sufficient. If there's any sort of issues, obviously more frequently. Once they hit around 9-10 years of age, I'd recommend every actually twice a year, every 6 months would be a good idea, to make sure everything looks okay. And then as they get older, blood work becomes important to check for any trouble. The ideal weight and height, that varies a lot, but usually you're looking at boxers should be around 80 to 100 pounds. If you can't feel their ribs easily, if you can't feel a waist, then they may be a bit chubby. As far as the height, they tend to be, kind of a medium-sized sort of tallness. We're talking probably something like 20, 24 inches, something like that. And obviously that varies depending on if they're show dogs. There are standards for dogs, but for health, the height isn't necessarily as important as the weight. Let's see, what else we got? 3 biggest mistakes. As far as 3 biggest mistakes, big thing you watch for is if a dog, the things that people have control over, not exercising them enough, so they don't get enough exercise, as well as actually just socialization. So dogs who are scared of other dogs, who are scared of people, behavior issues like that can be headed off by socializing your dog when they're young. Walks are really good for that. They also are good for weight, so that they don't get heavy. So if they get exercise and run around, they tend to be pretty good with that. And otherwise, just watching for any issues. Anything that looks weird, you might want to have them checked out. Don't ignore things if you're not sure what it is. Let's see, and why they jump more than other dogs. Part of it is that boxers are bred for a certain certain needs. They basically are bred for protection and also for hunting and things like that. So you basically will see that they are a breed that's very active and is involved in jumping. They're not necessarily bred for just companionship, though they're great for that, but they are gonna generally be more for their working breed, so they tend to be good at jumping. So that's probably part of the reason why they jump more than other dogs.
Okay, thank you for the interview.
You're